Hi, this is Dr. Javier Sevilla from Excel Pediatrics, and today we're going to talk about the 1 month visit, what to expect, some of the common things that we talk about during that important visit for your baby. So this is a very exciting time. Usually this is a transition. Most of the parents are starting to get used to the baby in terms of all the behaviors, all the cues that the baby gives you. Normally by this time, all those issues that were common during the delivery are now better, and this is really a time of transition. So we're going to start with actually mom. We're going to start looking at mom, just like on an airplane where people say, you know, when the oxygen masks come down, put the oxygen mask on you first and then your child. It's very important that we focus on you, mom, because if you're not well, you're not going to be able to take care of your child. And that's what I want to talk about first, which is postpartum depression. This is when that can start rearing its head and showing up. And the way that that usually shows up is if you're feeling kind of hopeless, depressed and sad most of the time, and if you're really finding it very hard to um, have any pleasure or interest in doing the things that you found pleasurable or interesting before. If you're finding that the answer to these questions is yes, you may start to have those symptoms of postpartum depression, and you do need to either let the pediatrician know or let your OB or your primary care doc know, because again, postpartum depression is something that can be treated very effectively, and if untreated, it can certainly affect the baby. So again, please let us know, either me as the pediatrician or your primary care doc or your OB, if you have any of those symptoms that I mentioned. Okay, let's talk about the baby now. As I shared with you, this is really a time of transition. So we're going to talk about probably the highlights at the 1 month checkup, and I would say probably one of the highlights is feeding. So if you're breastfeeding, again, you're probably now much more familiar with the cues that the baby has for feeding. Usually crying is a very late cue. That's kind of the point that I want to stress with you, is that you probably see other cues beforehand, before the baby actually starts to cry. How do you know if the baby's getting enough? That's probably the biggest question that people have around this time. And clearly, when you come for your checkup, when we do the checkup, we're going to measure the baby, and we're going to weigh the baby, and we're going to look at how the baby's growing during that period. But there's also a different way that you can gauge how much the baby's eating, especially if the baby's breastfed, and that is looking at the amount of wet diapers that the baby has. So we would really expect at this time about 6 or so wet diapers a day, and about 3 to 4 poops per day, or stools per day. So that will pretty much tell us that the baby's getting enough to eat. In terms of breastfeeding, again, the baby does not need any other nutrition apart from breastfeeding. So there's no need for water, there's no need for any type of tea, or any other substance but breast milk. Clearly, that is going to suffice with the baby in providing all the minerals, vitamins, and nutrients that the baby needs. If the baby is formula fed, again, the formula is the only thing that the baby needs at this point. One of the things that is going to become apparent to you during this month is that the baby's going to have a growth spurt. There's usually a pretty big growth spurt around 6 weeks of age. And so what you'll notice if you're breastfeeding, you'll notice that the baby is not satisfied with the normal amount of breast milk that you're producing. And it actually takes you about 3 days to produce more milk. And you know, breastfeeding is amazing in that respect, that your breast will actually produce exactly what the baby needs. But it can take about 3 days. So you may find around a month to 6 weeks that for a period of time your baby is not going to be kind of satisfied. And don't worry about that. It is very common. It is probably this growth spurt that's going on, and you just have to be patient to let your breast produce enough milk that will satisfy the baby. So again, look for that around the 6 week to 8 week period. With feeding, is there any other food that the baby should need? Again, we said no. Right now, it is basically breastfeeding. Again, if you're formula feeding, it is only formula at this point. So no other supplements are needed at this time. Let's talk about development and emotional well-being on the baby's side. Again, this is probably one of the biggest aspects of the 1 month visit. So one of the things that is amazing about your baby is that the brain, when the baby is born, has millions and millions of connections, okay? And those connections, some of them are going to be very useful to the baby, and some of them are not going to be very useful. Right now, the baby has all those connections. Everybody's born with all those connections. And just like, you know, somebody that is concentrating a lot, the baby that was inside your womb was really in a very silent, very controlled atmosphere, not exposed to a lot of outside noise, light, etc. And right now, the baby's exposed to all this noise, these new sounds, these new smells, these new images that the baby was not used to. So the brain is processing all that, and sometimes just the amount of connections that are there on the brain when the baby is born cause the baby to become very fussy towards the end of the day. So usually happens around the late afternoon or evening that you'll find that the baby just starts crying for no reason. You check the baby, it's not that the baby's hungry, it is not that the baby needs a diaper change. The baby is just very, very fussy, and you have no idea why. This is very common around this age. Before, people used to call this colic. People thought it was something to do with the stomach. People thought it was something to do with the gut. And the reason why people thought that was because, you know, when babies would be crying so much, they would be brought to the doctor, sometimes brought to the hospital, and the first thing that, you know, physicians would notice is what the tummy was all distended, and they would do an x-ray and would find a lot of gas in the baby's stomach. Now, I think in this case, the gas is the chicken and not the egg. So when a baby's crying a lot, what you will see is that the baby swallows a lot of gas. And sure enough, once the baby starts crying, you're going to actually, you know, have a ton of gas in your stomach and in your gut. So people thought that the crying was actually because of the gas and not the other way around. I think now we understand that this is more growing pains of the brain. That's kind of how I call it. And so these connections that I was telling you about, the body has to prune the ones that are not working or that are not necessary. But right now, the brain has so many connections that all that stimuli, all that light and sound, is really going to cause the baby to get overwhelmed towards the end of the day and cry. Now, the reason why I want to bring this up, and I think I want to spend a little bit of time talking about this, is that there's nothing more frustrating or nothing more anxiety producing than your baby crying and you as a mom not knowing what to do to stop the baby crying. And as I mentioned to you, this has nothing to do with what you are doing or not doing in terms of the baby. This is a very normal process. In fact, all mammals have colic, have this same process around the same time. So even baby whales and baby lions and baby monkeys have the same thing around this age. It doesn't matter if your baby is in downtown Manhattan or in the Amazon jungle. All babies go through this. It is really a developmental stage, and it is a pretty normal developmental stage when babies have this fussiness and this, episodes of crying around around a month to 2 months of age. Usually, these episodes of crying get worse around 6 weeks. So this is where kind of they reach the peak, and usually they start getting better around 2 months, and they're usually gone by around 3 months of age. It is not necessary to give the baby any medication. You'll see that there's lots of over-the-counter colic medications that you can buy. I really recommend people to stay away from that because, again, all those are based on the fact that that the crying is caused by gas. And as I was telling you, the scientific evidence shows that this is probably not gas, that this is really something neurological that's happening with the brain. Again, think about it as growing pains of the brain. So what can you do as a mom if this, if this happens with your baby, if your baby has these crying episodes, towards the evening every day? There's several things that you can try. Certainly holding the baby upright, may help. Some babies like to be walked around and the movement seems to help them. Some babies like some kind of white noise to calm down. And some babies actually, there's nothing you can do. They will still cry regardless what you do. And in those cases, there's absolutely nothing wrong in putting the baby back in the crib on their back, closing the door, and just letting the baby cry. It is absolutely fine to do that. What you'll see is the baby will wake up after a little bit. They will cry, they will fall asleep, they will wake up like nothing happened. So again, this is something that you can try, and don't feel guilty about doing that because again, this is a normal part of development. The reason why I'm stressing this out is that, again, this can actually be very stressful for new parents, and actually for any parents. My baby had very bad crying around this age, and so I know that it was actually very stressful. And if you look at shaken baby syndrome, so where people get so frustrated and angry that they shake the baby, this is the time where most of that happens in babies. And so that's why I want to be, very, very, very clear about this. Don't worry, you can let the baby cry. And if you see that you're getting very frustrated, very anxious, even angry that the baby still cries, just leave the baby on the crib, on the back, and walk out and let somebody else watch over the baby. But you should never ever shake the baby when this happens because the head is very, very, very fragile, and you can, you know, get some severe damage to the baby's brain if the baby is shaken at this time. Okay, the other thing that you're going to see related to development is that the sleep will actually, you know, change around this time. So the baby is waking up about every 3 hours, maybe 2 hours if the baby's breastfed. And around 6 weeks or so, this may change. So the baby will sleep a little bit more, sometimes 4 hours, sometimes 5 hours, and that's absolutely fine. So you're fine to let the baby sleep at night a little bit more. And what I would recommend you to do is to start helping the baby get used to the difference between day and night. Make it very, very different in terms of what is day and what is night for the baby. Of course, the baby is never going to know, like us, they don't have a watch, they don't know, hey, what's day, what's night, when am I supposed to be asleep, when am I supposed to be awake. So what I would recommend you to do is really keep the day very clear. And by very clear, I mean lots of lighting on the baby. So even if the baby is sleeping a nap, you know, make sure that there's lighting in there. And at night, the opposite. So during the night, make sure that there's darkness, that there's really no or as little sound as possible. You know, when the baby wakes up in the middle of the night, try not to stimulate the baby and try to keep things very boring at night, very calm and very boring. While during the day, the opposite, keep it, you know, keep stimulating the baby, and even though the baby's going to go down and sleep for naps, make sure that there's a big difference between daytime and nighttime. The way that we fall asleep is, as you know, through melatonin, which is a substance produced by our body, and that substance is produced in response to light. So when we look outside and light is going down, we start producing melatonin, and melatonin allows us to fall asleep. So again, this is a good practice to start to transition the baby so that the baby knows what's day and what's night and can start sleeping better during the next few weeks and months. Another thing about sleep, of course, and this is a reminder, make sure the baby's always sleeping on their back, never on the front. And again, you know, we definitely recommend people, and we recommend to parents for the baby not to sleep in the same bed with the parents because of a higher risk of SIDS, of sudden infant death syndrome. I understand that you know that this is something that you may want to do, but again, the literature and the scientific evidence shows that it does have a higher risk of SIDS. So we recommend the baby to sleep in a, you know, in a separate area in the crib. Again, the other precautions for SIDS, make sure that on the baby's crib there's no, you know, soft toys or blankets or pillows, because again of the risk of SIDS. Okay, so that is about sleep. Let's talk a little bit about safety now. And again, safety at this age is going to focus on the car seat. So make sure that the baby always is strapped to the car seat when you're going in the car. The car seat should be positioned on the back seat and rear facing. Okay, it should never be on the front seat of the car. We talked about the safety in sleep. That's probably the biggest aspect around this age. The next visit is going to be the 2-month visit, and that is when we will usually give the baby the first set of vaccines. So I would encourage you to watch the video on vaccines and get familiar with that topic. So again, a healthy baby is a happy baby, and if you have any questions about this video, please make sure that you ask them, and especially during the visit, so we can expand and talk a little bit more about those topics that concern you. Great, thank you.